It's time for your health show. Thank you so much for joining us. I'm Purity Museo. A very warm welcome. The third trimester is the last phase of your pregnancy. It lasts from 29 to 40 weeks, but our expert will tell us that. And during this trimester, your baby grows, develops, and starts to change position to get ready for birth. You've only got a few more weeks to go, but this part of your pregnancy can be the most challenging. Let's find out what to expect and what to do, what a to-do list is like during this phase of pregnancy. Our guest is Dr. Maureen Owiti, a gynecologist. Welcome to the show. Welcome to the show. This is the third trimester, the third week we are talking about pregnancy, and it's been an interesting conversation, a lot of things to learn about the pregnancy journey, but not this trimester. How sensitive, how important is the last trimester of a pregnancy for the delivery to take place?
Thank you so much, Purity, and thank you for inviting me again. Now, the third trimester, as you have rightly put it, now would be another challenging trimester. As I said, there's some very lucky people. I always tell them I don't like you very much. In quotes, of course, I don't hate them. But there are women who actually, pregnancy to them doesn't seem to affect them, not the first, second, third. But for the rest of us mere mortals, this is when things get a bit hectic.
Yeah.
Your uterus has grown. It's pressing up on your lungs. You have difficulty breathing. You start walking like a duck or a penguin.
You're scaring me.
Yes. No. What I'll tell everybody, when you see your baby, it's all worthwhile. It's always worthwhile. It's just priceless, the feeling of motherhood. I've been very fortunate to have been a mother twice, and you just love your children to bits. And I don't know what it is. You just see your children and just this
forget everything,
pouring of love and emotion out there. So all the sleepless nights, all the waddling and what have you, it's worthwhile. So it's something. Don't be scared.
But
and
how challenging?
The beauty about a pregnancy, it ends. If I tell you have diabetes, it's a lifelong diagnosis. Even if you're able to get your sugar controlled without medication, it's not changing the fact that you have diabetes. And a majority of us would have to take some medication to be able to control diabetes. However, a pregnancy ends. So they say all good things come to an end, and so is pregnancy. So it's the last mile. It's the last mile. So for a lot of people, that's when things become challenging. So you have all those issues, not sleeping at night. But I tell them, that's good, you're getting practice, because when the baby comes, the cries at night, you will not be sleeping at night. So I tell them, you're on it easy too. You're preparing for when the actual baby is going to come. So some of the complications would be, as I said, because the full-term uterus is going to press on the diaphragm, making it very difficult for you to breathe. So you find, I don't know if you've ever noticed that the nose of pregnant women tends to be a bit wider than how it looks when they're not pregnant. And it's just those changes that are occurring because you have to breathe faster to accommodate the changes that are occurring on your body. Now you've asked what is there to watch out for. I'm very comfortable once a woman reaches 28 weeks. Unlike the second trimester, whereby, yes, the baby's alive and we know it's kicking, any delivery in the second trimester, the probability of survival of that fetus is low, and the further away it is from 28 weeks, so a 26-weeker would have better chances than a 24-weeker, would have better chances than, say, a 20-weeker. So the further it is away from 28 weeks, the less the chances of survival. And I think in this neck of the woods, I stand to be corrected. I'm not aware of any baby that was actually 20 weeks, maybe it was 20 weeks, but they had a wrong date, which has survived to term. We've had babies who are low birth weight, like say 400 grams, and they've survived, but those were not 20-week-old by gestation. They were more mature, but they were just small for their gestational age.
Yeah.
So from 28 weeks, with a good neonatal center, unless the baby gets some other complication, such as a bad infection, or has, say, a congenital abnormality, so maybe something wrong with their heart, something wrong with their lungs. If the baby is normal, this a baby with good care should be able to go home. So once a mother has hit 28 weeks, I tell them, you can bring whatever it is you want to bring it on. We're ready for you.
Yeah.
Below 28 weeks, it would be a bit tricky. So this is a time we're preparing for labor. So again, the birth plan we have to do, and birth plan you start right from the first trimester. Giving birth, and I'm not just saying giving birth, healthcare in general is expensive. We've had even Parliament trying to censure the cost of healthcare. They're barking up the wrong tree. The issue is not the hospitals. The issue is not the healthcare providers. The issue is what environment, at what cost are we buying healthcare commodities, and how are we cautioning people? So it is probably them to look at themselves instead of looking at the fees that people are charging on how can we go about lowering this. Something as simple as electricity. Are doctors or hospitals going to be charged less electricity to be able to give lower fees? Staff, how much do you want to pay a nurse working in your clinic? Are you going to pay them the way you pay a house help? I'm not saying that house helps are not providing a valuable service, but surely you must pay a skilled health worker something commensurate to the work that they feel that they're doing. Yeah. And I tell people, it's not even so much the amount of money that we're being paid. We live in a very expensive country. We live in a very, very expensive country. The cost of living here is ridiculous. So value for the shilling, what other Africans can do with 100 shillings, a Kenyan can't do. So, and that is just very, very realistically, and not trying to hit out at politicians, but the issue is how can they make the cost of living better? And even in a private health setting, we have public health, and with NHIF, anyone can access a public health and be able to have access to good quality healthcare. How can they focus such that these public hospitals are equipped with the right equipments and right commodities? Because in terms of the skill of the workers, you have some of the best healthcare workers in public health setting. Okay. So back to the trimester itself. So for the birth plan, especially for those who want to deliver in a private setting, the cost is not small. So discuss with your doctor what are the approximate costs to expect in case of a normal delivery. People feel that cesarean sections are just being done. I tell you, you don't know. If you have ever had a child with, say, cerebral palsy, you know better somebody has done a cesarean section in a timely manner than having a child who's going to have a permanent disability for the rest of your life. So it's also looking at it, and I'm quite confident that majority of colleagues, I'm not going to say that any society you'll have one or two rotten apples. We know them, and there are quacks also out there, but majority of professional healthcare workers are going to do everything that is in the interest of the mother and in the interest of her baby. Okay. Yeah.
And you've made this stage very relaxed for moms out there and moms to be, but do we still have red flags on the part of the red flag symptoms for the baby, the mother? You can enlighten us on that. Yeah.
Thank you. And I think on the red flags, we had mentioned them again. So just to repeat, it would be bleeding, the drainage of the amniotic fluid. It would be, say, headaches, convulsions. And again, if the baby is not playing properly, by 28 weeks, we have distinct kicks. Remember we said in the second trimester, the kick starts as something a flutter, and you normally, even up to 20 weeks, some people have not yet started experiencing the movements. And the movements are very erratic. So below 28 weeks, that's in the second trimester, we can't rely on the mother's perception of movements to ascertain whether the baby is well or not. But by 28 weeks, you have more or less a certain pattern on the way the baby is playing. So you're able to feel that, no, my baby is not playing as the way it normally plays. There's something different about the way it's playing. And it goes either way. Whether the heart rate appears to be, the perception appears to be more than usual, or it's less than what you normally perceive. So that is now a very, very important sign of how is your baby playing. Because women are not pregnant just for the sake of being pregnant. They're pregnant to deliver a live baby. And our premise is that we hope to do so. Unfortunately, it does not happen like that every single time. What we do is support the mother regardless of the outcome of the pregnancy. But everybody's joy and wish and hope is that the mother will come out of this healthy and we're going to have a healthy baby. The danger signs, as I said, so same thing, clinic, and we're checking the same things. Is your pressure fine? Are your blood levels okay? Is your urine clear? Is there any infection? Are there any proteins in this urine? We're just constantly checking same things. The simple things, you're going to pick them up. Those with other complications, I'm not going to talk about them, but you're going to institute care based on the complications. So around between 24 and 28 weeks, normally screen for diabetes. You pick any signs of either deranged sugar levels or what we call deranged glucose tolerance, or overt diabetes in pregnancy. You institute management because it's going to affect how the pregnancy, are you having a normal delivery? Are you having a cesarean section? Is the baby lying well towards the time of delivery? So you find some babies are breech. Breech meaning, okay, so we normally say a baby is either cephalic, breech, or a transverse lie, or an unstable lie. So in cephalic, that's normal. That means the baby is coming out head first. And that's majority of babies. There's some babies who, for whatever reasons, are lying breech. So breech means that they're coming out with either their lower extremities or their hips coming out first rather than the head. And transverse is the baby's lying across. For a transverse lie, we cannot have a normal delivery. For breech deliveries, a lot of research has been done, and these babies tend to have a lot of problems with the neurological development. So we advise either to do what is called an external cephalic version, so put the baby back in cephalic position, but you must have either the skill to be able to do so and the facilities to manage cesarean section, because during that process the baby can get distressed and you may have to deliver immediately. Very few facilities offer this, so majority of mothers who are remaining breech all the way to about 38, 39 weeks of pregnancy will end up having a cesarean section just for the safety of the baby.
Okay.
If it's not the position, it's just as I said, the same things. We're screening them, making sure they're okay. Those that we can intervene, we intervene. Our big killers are still going to remain the same. And it's bleeding, it's the high blood pressure, it's infection, and obstructed labor. Labor we'll talk about, and the obstructed labor we're going to talk about when we have the session on labor and delivery.
Right, and experts say that the behavior of the mother affects the health of the child. Maybe what are some of these risk factors or behaviors that could negatively affect the health of this child, and that could lead even to complications of the child once born or even during pregnancy?
Okay. So we also have this saying of eating for two. Okay, I don't believe in eating for two because you have a higher risk of having a baby that is quite big or macrosomic. A macrosomic baby will be a baby be over 4.5 kilos. Now, you know, the bigger the baby, the higher the probability of getting a cesarean section because either the maternal pelvis will be too small for that baby or the baby will be too big for a normal sized pelvis. So nutrition is very important. Along with that, other vices. So you find things like alcohol, smoking, drug addiction. I think I should have mentioned that from the first episode. And even from preconception care, that those are things, again, we're screening for. And we're going to advise somebody who wants to be pregnant, definitely we want to stop these particular habits, and especially when it comes to alcohol and drug addiction, and even smoking. All of these are things that the mother should modify and stop. It's for me, it's not negotiable. It's obviously easier said than done. Do you need to be put in touch with some of these facilities that help to take care of some of these addictions so that you actually stop and are going to have a healthy pregnancy? We have babies that if the mother has a drug addiction, and contrary to public opinion that it's not so very common in this part of the world, it's getting more common, and this is something that is real and it's happening. So if you have a mother who's addicted to, say, things like heroin and cocaine, the baby is born addicted to heroin and cocaine. So you can imagine having to do a rehabilitation on a neonate. That is, the experts who are able to do that, but you can imagine the type of intensive care you need for this type of baby. So you obviously want to have corrected some of those vices. In terms of, again, is she developing an infection? The most common is a urine infection. That's why every visit we're checking the urine. The protein would be a sign of the high blood pressure in pregnancy. Again, that's why we're checking the urine at every visit during the antenatal period. So it's just attend your clinics. Your visits are going to become more frequent. So normally we'll see a normal mother once every month up to about 28 weeks of pregnancy. From 28 weeks, we're going to see you every 2 weeks. And in the last month or so, we may be even see you every month because we've said the reason we're having this more and more frequent screening is the earlier you pick up something, the faster you react to it, the better the outcome.
Yeah. And what are some of the, as we wind up, complications that may affect the baby if these risk factors are not addressed? Okay.
So you find that, let us say, something like high blood pressure. With the high blood pressure, it can even affect the placenta. Sometimes the placenta shears off, what we call an abruption. When the placenta shears off, you lose the baby. The baby can be dead. Infection. Any baby born with sepsis, their immune system is not fully mature. They're more susceptible to infections, and this can actually be a cause of death for the baby. With sepsis, they can get, that's a severe infection in the blood. All their other organs can get affected. So they can have liver failure, they can have renal failure, they can have respiratory failure. So babies are not able to manage infections well. So everything should be done to try to prevent get the babies getting an infection in utero or at the time when they are born.
Okay.
Prematurity, you have, say, we said a convulsion. The moment you're having eclampsia, whether it was at 24 weeks or it's at 28 weeks, we have to deliver the baby now. Premature babies, so I'm saying a term baby is finding it difficult to fight with infection. Now, what of a premature baby? How are they going to fight an infection? So among other issues, their lungs are not mature, they're not able to breathe properly, so they get a lot of respiratory distress. And a lot of premature babies also, the development of their nervous system and their brain is not fully developed. You have to protect, especially if they're going to have a normal delivery. They have high risks of bleeds in the brain. So a lot of interventions have to be done in order to prevent the infection, see if we're going to accelerate or speed up the lung maturity, and give something to protect the brain of this fetus if they're coming before time.
Okay.
So you can see our work is really cut out if we're getting any complications at any point of the pregnancy.
You want to leave us with a to-do list for moms during this stage?
A to-do list for moms: birth plan, birth plan, birth plan. Must be ready with it. But enjoy your pregnancy and good luck with your delivery.
Enjoy your pregnancy, good luck with your delivery. Thank you so much once again, Dr. Maureen, for making time for us this evening. We really not taking it for granted. All right, that's where we wrap it up right here on Your Health Show. Thank you for your company. My name is Purity Museo. I'll see you again next week, same place, same time. And this time we'll talk about childbirth. You do not want to miss the labor, stages of labor, and some of the options available for delivery for moms. So see you again next time. Do enjoy the rest of our programming, and God bless.